Hello, my name is Dorian Maple, and for this discussion board assignment, I will be discussing the anterior cruciate ligament, or the ACL. I will also be discussing how ACL injuries occur and how they can negatively impact the athlete's performance and why the ACL is important. The ACL is one of the most common yet most serious knee injuries in sports today. The ACL is a strong band of tissue that connect to the femur or thigh bone, that connect to the tibia or shin bone. It plays a crucial role in stabilizing the knee joint, especially during movements that involve sudden stops, pivots, or changes in direction. When the ACL is torn or strained, it can cause intense pain, swelling, and a significant loss in stability. These are all very bad for athletes, I feel like. ACL tear often requires intense rehab and almost all the time surgery. The ACL is vital because it prevents the tibia from sliding too far down under the femur. It helps control rotational movements to the knee. Without it, athletes will struggle to perform powerful movements like changes in directions, and it overall drastically plummets their performance. Comparing male athletes to female athletes, I want to say that it is particularly concerning that female athletes are 2 to 8 times more likely to suffer ACL injuries than males in the similar sports. Researchers have studied that several factors that contribute to the difference. I want to get into the anatomical, hormonal, and biomechanical differences. First, I want to start off with anatomical differences. Females generally have a wider pelvis, which changes the angle of the femur and knee. This is often referred to as the acute angle. A larger acute angle can increase stress on the ACL during movement. Additionally, females tend to have smaller ACLs, which may make the ligament more susceptible to injury. Next, I want to cover hormonal factors. Hormonal factors also play a role. Fluctuations in estrogen and relaxation during the menstrual cycle can affect ligament laxity, meaning that the ACL may be more susceptible or more flexible and less stable at certain times, increasing the likelihood of injury. And lastly, I want to cover the biomechanical differences from male and female athletes. Biomechanical differences include movement patterns. For example, many female athletes land form jumps with their knees more extended and inward. By doing this creates a greater strain on their ACL. Although males tend to land with more force and more hip and knee flexion, this helps them absorb the force that they are getting from the jump and effectively protect their ACL. Also, some external factors also contribute to the differences as well. Things like differences in training techniques, footwear, playing surfaces can all influence the risk of injuring an ACL. Some female athletes receive less neuromuscular training focused on strength, balance, and landing mechanics. Sports like soccer, basketball, and volleyball, which involve jumping and pivoting a lot more than other sports. These sports also have the highest rates of ACL injury rate, or these sports have the highest rates of ACL injury. Yeah, that sounds right. Okay, in my opinion, a good way to reduce this rate or lower the rate of ACL injury is prevention programs. These are key, and evidence-based approaches such as neuromuscular training and plyometric drills and proper warm-up routines have been shown to improve the rate or improve the knee stability of athletes and reduce the rate of ACL injury. In conclusion, understanding why females are at higher risk of ACL injuries allows coaches, trainers, and athletes to take preventative steps through training, education, and conditioning. Also, it allows them to teach the proper technique through drills, just practice in the weight room, and allows them to, what's the word I'm looking for? Allows them to have a preventative mindset by addressing anatomical, hormonal, and biomechanical differences and improving training methods.